Have you ever wondered what narcissistic personality disorder is? It's a question that has perplexed many, and today we're going to shed some light on this complex and often misunderstood mental condition. Narcissistic Personality Disorder, also known as NPD, is a mental health disorder characterized by a grandiose sense of self-importance. It's not just about being self-centered or vain, it's a deep-seated pattern of behaviors and thoughts that significantly impacts one's relationships and daily life. Individuals with NPD often possess an inflated perception of their own worth or importance. They believe they're exceptional, even if they haven't achieved anything extraordinary. They expect to be recognized as superior without the necessary achievements to back it up. But it's not all about arrogance and superiority. There's also an intense need for excessive attention and admiration. Those with NPD crave constant praise. They want to be the center of attention, the star of the show, the one everyone admires. You could say they have an insatiable appetite for adulation. However, beneath this facade of confidence and self-assuredness, there often lurks a fragile self-esteem. They're extremely vulnerable to the slightest criticism or perceived defeat. Even a minor setback can trigger feelings of shame and humiliation. And perhaps one of the most challenging aspects of NPD is the lack of empathy for others. Those with this disorder often struggle to recognize or understand others' feelings. They're so consumed by their own desires and self-image that they disregard the needs and feelings of those around them. But remember, NPD isn't about someone who's simply self-absorbed or egotistical. It's a serious mental health condition that can cause significant distress and impairment. It's not a choice. It's not a character flaw. It's a disorder that needs understanding and compassion. Now that we have a basic understanding of what NPD is, let's delve into the behaviors associated with this disorder. And as we do, let's remember to approach this topic with empathy and understanding. After all, mental health is a journey, and everyone's path is unique. Narcissistic personality disorder manifests in a variety of behaviors. The most striking characteristic of someone with narcissistic personality disorder, or NPD, is their grandiose sense of self-importance. They often have a heightened sense of entitlement, expecting preferential treatment and unquestioning compliance with their expectations. Now, imagine being around someone who constantly needs admiration and validation. People with NPD crave praise and struggle when they don't receive it. They may become preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. This can sometimes lead to them exaggerating their achievements or talents, painting a picture of themselves that is larger than life. One of the more troubling behaviors associated with NPD is a lack of empathy. They often disregard or are oblivious to the feelings and needs of others. This can lead to them taking advantage of others to achieve their own ends, or being envious of others and believing others envy them. These behaviors can strain relationships significantly. Their lack of empathy and their need for admiration can create a one-sided dynamic where they are always taking and rarely giving. They may also react with rage or contempt, or resort to belittling others to make themselves appear superior. These behaviors can also cause issues in various areas of a person's life. In the workplace, they may struggle to work as part of a team, always seeking the limelight and taking credit for others' work. In their personal lives, their relationships may be superficial and exist only to serve their self-interest. It's important to remember that people with NPD are not simply being difficult or selfish. They are dealing with a mental health disorder that affects their perception of themselves and others. Understanding these behaviors can help us better empathize with those dealing with NPD and provide them the support they need. These behaviors can cause significant difficulties, but what causes someone to develop NPD? The exact cause of narcissistic personality disorder remains unknown. This statement may sound perplexing, but it's true. Like many mental health conditions, the causes of narcissistic personality disorder, or NPD, are complex and multifaceted. Let's delve into the possible factors that contribute to the development of NPD. Firstly, there's the genetic and biological component. It's believed that certain inherited characteristics or genes might make a person more susceptible to developing NPD. However, having these genes doesn't guarantee that a person will develop the disorder. It merely increases the risk. Next, we have environmental factors and upbringing. Children who are excessively pampered or excessively criticized by their parents or guardians may be at a higher risk for NPD. This is particularly true if the child is used as an extension of the parent or is manipulated to uphold the parent's self-esteem. In such circumstances, the child may develop an inflated sense of self-importance or a deep-seated belief that they are special and deserve special treatment. And then there's personality and temperament. Some researchers suggest that our individual temperaments, shaped by both our genetic makeup and our environment, can make us more susceptible to NPD. For instance, if a person naturally has a strong desire for power or admiration, this could potentially make them more prone to developing narcissistic traits. It's important to emphasize that it's usually a combination of these factors that results in the development of NPD. Moreover, the presence of these factors doesn't automatically mean that a person will develop the disorder, they merely increase the risk. In conclusion, the causes of NPD are multifaceted, involving a complex interplay of genetics, environment, and individual personality traits. While we may not yet fully understand the precise cause of NPD, understanding these contributing factors can provide valuable insights into the disorder. And with these insights, we can better manage and potentially prevent the disorder. Understanding the causes can help in managing the disorder. But how is NPD diagnosed? Diagnosing narcissistic personality disorder isn't as straightforward as running a lab test. It involves a complex assessment process that goes beyond the surface to uncover the root of self-centered, arrogant, and domineering behaviors. The primary tool in this diagnostic process is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, better known as the DSM-5. This manual is like a compass for mental health professionals, guiding them through the intricate landscape of mental disorders. It sets out specific criteria that must be met for a diagnosis of narcissistic personality disorder. According to the DSM-5, someone with NPD typically shows a pervasive pattern of grandiosity, a constant need for admiration, and a lack of empathy. They often believe they are special or unique, and can only be understood by or should associate with other special or high-status people. They may demonstrate arrogant, haughty behaviors or attitudes and become envious of others or believe others are envious of them. It's important to note that at least 5 of these criteria must be present for a diagnosis, but the DSM-5 is just one part of the puzzle. A mental health professional will conduct a thorough psychological evaluation to gain a comprehensive understanding of the individual. They'll explore the person's history, their relationships, their behaviors, and their thought patterns. Additionally, they may also investigate the individual's physical health. The reason behind this is to rule out any other conditions that might be causing or contributing to the person's symptoms. For instance, certain medical conditions or substance abuse issues can mimic or exacerbate narcissistic behaviors, so it's crucial to identify and address these if present. Diagnosis is a careful process that takes time. It's not about labeling or stigmatizing, but about understanding and helping. It's about seeing the person behind the behaviors, the human beneath the disorder. Diagnosis is the first step towards managing NPD. So what does management and treatment look like? Managing and treating narcissistic personality disorder can be challenging, but it's not impossible. It requires a considerable amount of patience, understanding, and professional guidance. The most common treatment for NPD is psychotherapy, also known as talk therapy. This method leverages the power of communication to help individuals understand and manage their disorder. Psychotherapy can be a potent tool in navigating the complexities of NPD, as it allows the individual to explore the origins of their behaviors, feelings, and distorted self-image. Cognitive behavioral therapy, a specific type of psychotherapy, is often used in treating NPD. It focuses on identifying and changing harmful thought patterns that lead to destructive behaviors and beliefs. It's about rewiring the brain's way of thinking, shedding light on the negative impacts of narcissism, and promoting healthier ways to interact with others. Another aspect of psychotherapy is group therapy. This involves individuals with similar conditions coming together under the guidance of a mental health professional. Group therapy provides a supportive environment for individuals to share experiences, learn from one another, and develop social skills. In some instances, medications may be incorporated into the treatment plan, not to treat NPD directly, but to manage conditions often associated with it, like depression or anxiety. Antidepressants, mood stabilizers, or antipsychotic drugs can be used depending on the individual's specific needs. Regardless of the treatment approach, it's important to remember that progress may be slow. Those with NPD often have a deep-seated belief in their superiority, which can make acknowledging the need for change difficult. However, with consistent therapy and a supportive environment, positive changes can occur. It's crucial to seek help from a mental health professional if you or someone you know exhibits symptoms of NPD. These professionals can provide the necessary guidance, support, and treatment options to manage and cope with this disorder. While NPD can be a challenging disorder to manage, understanding and seeking help can make all the difference. Remember, nobody has to navigate these waters alone. There is always help available, and taking that first step can lead to a journey of self-improvement and better relationships.